Hi, Dr. Adler here, and I just wanted to talk about some of the things that can go wrong with your teeth and how we fix them. On my previous video, I showed you the anatomy of a tooth, and here is some of the ways that we fix things that happen with teeth when you get cavities. Cavities get too big, you break a tooth, you lose a tooth. Here is an example of a root canal, which happens when, as we said before, this is your enamel, this is your dentin, and here is the nerve chamber. If a cavity breaks through enamel and goes into the dentin, we do a filling. If you come for your checkups every 6 months, we can see those when they're small, and then we drill it out and put a filling in. While it stays in your enamel, since it's the hardest part of your body, we don't need to do a filling necessarily, and we usually watch those. After that, if a cavity gets so big, or a filling breaks, or your tooth breaks, and it goes into the nerve, then we do something called a root canal. And we will refer you to a root canal specialist who then takes the nerve out of the canal. A molar has 3 canals, that's why it looks like this in this picture. She cleans out the nerve, and then she places a filling in it. And that's what seals it off from the rest of the body in the jawbone and protects you from bacteria. You then would come back to us where we put a crown on the tooth. And sometimes you also need a post, which might be in this picture, yes, which is a screw. In case there's no tooth left here, we put a screw here, the head sticks out like that, and now I can build a base for the crown. And the reason you need a crown when you get a root canal is because when we take out the nerve, the tooth becomes a little more brittle. So as a protocol, we put a porcelain cap on top of the tooth to protect it from chipping, breaking further, or cracking. If, for any reason, you need to lose a tooth, a cracked tooth is one reason, I recommend you get a dental implant. This is a dental implant. A titanium screw is put into the jawbone under a local anesthesia shot, just the same way you would get a filling. I would send you to a surgeon to do this. You would come back. It takes 4 to 6 months for this to adhere to the bone, and you go see your surgeon back and forth in that time. And then once it adheres, you come here and I place a beautiful crown on there that you can use as a tooth like any other in your mouth. And you can floss in between them, which I like. Another way to replace a missing tooth is a bridge. Here is an implant bridge, but you could also see that if these were 2 teeth, you could connect 3 crowns together and have a bridge. I recommend, if you're a candidate for implants, to get the implant because it's much easier to take care of. A bridge you need to clean underneath. However, bridges are tried and true, been in dentistry forever, and they do work as well if you're missing a tooth. A third way to replace a missing tooth is to get a denture. And that is a removable piece that is made at the lab and clicks on to the adjacent teeth. That I would recommend if finances are a problem, but otherwise I would highly recommend the implant. And that is an example of different dental work that you could get here at the office and you might need. And everything comes out beautifully, and it looks like nothing ever happened. So have a great day, and thank you, and subscribe.